Welcome back to Employers Are Asking. My name is Sarah Michaels, and I'm the Director of Kinetiq Health here at Apex Benefits and a registered nurse. This week, we got asked a question from one of our clients, and it was, our employees are unsure of when to utilize the urgent care versus the ER. Do you have any helpful tips to distinguish the two? Well, you're in luck because as a practicing nurse who spends a lot of her weekends in the largest ER, pediatric ER right here in our state, I would love to answer that question. Now, the long answer to that is really ERs are used every day, 24/7 for anything and everything because they have the capacity. But the correct answer to that is that doesn't mean we should use the ER for anything and everything. So let's really triage when we should be going to the ER versus when we should be going to the urgent care. And before you even get to the urgent care, when should I be going to my provider's office? So to start, let's talk about some helpful tips to avoid the ER and urgent care altogether. We preach a lot here at Apex Benefits about preventive care. There's so many important reasons that why we need to go to a doctor to get our free preventive exam every single year. But in my opinion, one of the most important reasons is because you want to establish care with the provider. Because when you are sick, those should be the first people you actually call. Now you know who to call, when to call them, and you can actually go utilize that service. 2, make sure that you're managing your chronic conditions. I can't tell you how many times people are using the emergency room because they have a chronic condition that's just not being properly managed. Maybe they forgot their medication. Maybe they don't know who to see in terms of a specialist. And again, your primary care physician can get you on the right track. 3, refilling medications. So many people wait to refill their medications till the last day, and then there's some kind of hiccup and they have to wait even longer. Here at Apex, we try to get our pharmacists to immediately fix that and make sure that when you're standing in line, you can get your prescription. But of course, some people, it's just a little too late and you're still waiting for that doctor, and so they use the ER. So I always say a week before your prescription is actually out, make sure you're contacting your doctor so you can get that filled right away and there's no lapse in medication. And know how to utilize your benefits. We always preach about, do you know that you have an EAP that you can use if you're having a mental health crisis? Do you know who your provider is? Do you even know where your local emergency room or your urgent care is? Those are things you want to know before you actually need to utilize them. So now let's say I'm sick. In what order do I go? Well, as your parents have probably told you growing up, there is a time and place to stay home and try to self-treat, right? So if you have very minor symptoms, maybe you have a headache, you're starting to have a cough, a low-grade fever below 100 degrees Fahrenheit, truly try to start with resting, taking Tylenol as needed, drinking lots of fluids, but primarily trying to give your body a break and some time of rest. Now, if after a couple days those symptoms are only getting worse, now's the time we really need to call our provider. So start with your doctor's office. When you're calling them, explain what's happening, and they'll tell you right away whether or not they can handle that in their office, or they recommend that you go to an urgent care. Urgent care is truly your next stop shop, and you'd be surprised by how much an urgent care can actually handle. I know for me, it oftentimes is sports injuries. Maybe in an active family, it's animal bites, it's broken bones, sometimes even cuts to our head. Urgent cares are staffed to be able to handle x-rays, handle labs, prescribe medications, and do a lot of things such as basic stitching to keep you out of the emergency room. And the best thing I can say about when do I truly use the emergency room, it's just that. Please use it in an emergency situation. If you're having to think, when would I call 911? That's pretty same of when should I go to my emergency room. Anytime you're having trouble breathing, anytime you have signs of a heart attack, such as tightness of breath, your chest hurts, your body just doesn't feel good all over, anytime you have signs of a stroke, maybe people are difficult to understand or they really can't understand what you're saying back, there's slurred speech, your body just isn't moving properly. And of course, anytime you're having bleeding that's just uncontrolled or you lose consciousness and you have severe trauma, those are all some reasons that you would absolutely go to the ER. And whenever you're questioning where you should go, feel free to have somebody actually call an urgent care and ask, can I be seen here? And they will immediately tell you whether or not you should go there or go directly to the emergency room. Those are all some tips that I hope you guys take to heart, but always remember there are other options out there. The most important thing to know is, where do I go? Who do I call? You don't want to wait in case of an emergency. That's Employers Are Asking. We'll see you here next time.